Hey everyone, welcome back to Wonder Science. In today's video, I just wanted to talk about, I had a little presentation on just some eating disorders because I know a lot of people may face such disorders, whether that's excessive eating or not eating at all. There's various different types of eating disorders that a person can have. So just kind of thought it was an interesting thing to talk about and like some of the symptoms, just so you know, just information about such disorders. And eating disorders can be caused by various different factors, such as like psychological factors and physical factors. Like depression is one of the big ones that can cause eating disorders, and just like the need to want to be like perfect and try to fit around it and meet some like expectations. And it can include extreme emotions and attitudes that surround weight and food, and it can overall just affect your physical, both if you're too skinny or too overweight, and your social functioning and how you can really communicate and keep your relationships. And like I said, it can often co-occur with other conditions such as mood and anxiety disorders. So there are three types of eating disorders. There's anorexia, there's bulimia, and there's binge eating disorder. So they're all a little different. They're all a little similar, but these are the main three eating disorders that we're going to talk about, and the biggest ones that are mostly common. Anorexia is essentially self-starvation and excessive weight loss. So you're trying to lose weight, but you're doing it in an unhealthy manner, and you're really just starving yourself, and you're not really keeping your body healthy. So you're not maintaining body weight at above a minimal normal weight for height, body type, age, and activity level, because you want to be in that right in the center BMI for you to have the best health possible. You don't want to be too underweight. You don't want to be too overweight. You want to just be right in the middle with your body mass index. And extreme fear of gaining weight or being fat is one of the biggest symptoms. You just don't want to gain that weight, and you, like I said, you want to fit into something. You want to meet some expectation. So that's one of the biggest reasons that people experience anorexia. And some more symptoms: just feeling fat or weight despite losing heavy amounts of waste, loss of menstrual periods, and extreme concern with body weight and shape. So bulimia nervosa, just like a very hidden, secretive cycle of binge eating, followed by purging. Purging just means like throwing up or getting rid of all that food. So essentially, we eat a lot of food in a short amount of time, just rapidly consuming food, but then immediately after, just getting it out of your body, getting it out of your system. So symptoms include just repeated episodes of binging and purging. And when you're binging, you're feeling out of control, and you just keep eating even beyond like a comfortable fullness. You just keep eating, and then you throw it up all after, which is very unhealthy for your health. And then purging after a binge, which is self-induced vomiting, abuse of laxatives, diet pills, diuretics, excessive exercise, or fasting. Frequent dieting, just dieting excessively beyond like a healthy type of diet. You just like Mediterranean diet, something healthy like that, but instead almost starving yourself, like just dieting or unhealthily as well. Extreme concern with body weight and shape. That's one of the similar between anorexia and bulimia. I think there's binge eating disorders. This one is more on the obesity side, characterized by periods of uncontrolled, impulsive, or continuous eating beyond the point of feeling comfortably full. So again, like I said, just similar to bulimia, instead of throwing it up after, you just keep eating it, but you don't. It's just compulsive overeating, essentially. There's no purging, but there are many sporadic fasts or repetitive diets, often feeling shame or self-hatred after a binge, just feeling regret after you end up eating too much. It's uncontrolled, and then after that, you feel like, oh, I shouldn't have done that, but you can't control it. So for binge eating, a lot of the times it can be caused by anxiety and depression and loneliness, which can contribute to this binge eating. And body weight may vary from normal to mild, moderate, or severe. And some more causes, just trauma, just your body image. Sometimes it can also be genetics, but also occurs with mental health issues, like I said, with like loneliness, depression, all those kind of different mood disorders. So there's other eating disorders can include a combination of anorexia, bulimia, and binge eating, just like different symptoms put into one, various different effects, various different thought processes, and different like needs and uncontrollable desires, essentially. And these behaviors may not be clinically considered as a full syndrome eating disorder, like the ones we talked about before, but they can still be dangerous and emotionally draining. So the biggest causes can either be because of genetic and biology, but I think that one of the biggest ones would be the psychological and emotional health because of something that you're going through, some maybe family member loss that's putting you in depression, some things like that, loneliness, all those type of things can really spark and cause more eating disorders. And it's a very serious cause. It can be fatal. It can affect anyone, and you can still recover from eating disorder, but you have to take time, you have to take treatment, you have to definitely get some help if you really wanted to really help yourself and fix whatever hole you've really dug yourself into. Risk factors, just family influence, other mental health disorders, dieting, stress, social media pressure, maintaining your body images, any comments or messages that you get from maybe a post, stuff like that. And then like sports that emphasize weight, some people have to meet a certain weight class, so that can really force them to either lose or gain a lot of weight. Complications, again, serious health problems, depression, anxiety, suicidal thoughts or behaviors, and then it can affect your growth and your development as a person. It can also be difficult to maintain your relationships and social problems, social connections with your family and your friends. So it's very important that you try to get as much help as you can so you can really stay healthy and keep all the connections and the people that care about you around you. Substance use, work and school problems, again, that deals hand in hand with stress, and then it can lead to death as well. Fatal. If it gets to that level, it is a fatal condition. So getting help managing the eating disorder can be a long-term challenge. So you should definitely reach out to a primary care physician, mental health professional, and registered dietitian. And you should obviously stay connected as much as you can with your family. Try not to push them away from your life. Keep them as close as you can so you can really receive the best help that you can. So I just thought this was a very important topic to talk about, as many people may be going through similar situations. So I thought it'd be really good for us to learn a little bit more about really what's going on with these type of eating disorders, because not many people might not know much about them. So I thought it would be a really good thing to talk about, and I hope you all learned something important or valuable from this video.